Hello, my name is Elizabeth Oberly, and this is my presentation on documentation burden in nursing. Documentation burden refers to the extra time and energy nurses spend on documenting patient care. It includes repetitive, duplicative, and even irrelevant charting, and has become common in healthcare today. This burden can happen with both electronic systems and traditional paper charting. Research by Gessner and colleagues show nurses enter between 600 and 800 pieces of information in just one 12-hour shift. Documentation plays a critical role in nursing. It serves as a legal record of the care that we provide. It ensures accurate handoffs between providers, which is essential for continuity of care. It helps identify trends in patient conditions over time. It prevents errors by keeping information consistent and up to date, and it supports billing and coding, making sure that services are reimbursed appropriately. There are several types of documentation that we use. The electronic health records are the most common now. Flow sheets track routine care and vital signs. Narrative notes are used by providers and nurses to describe patient assessments and interventions in detail. The MAR, or the Medication Administration Record, logs all medications given, and incident reports document unexpected events or errors for quality improvement or legal reasons. The big turning point in the use of electronic health records after the HITECH Act of 2009 passed, which incentivized electronic health record use. As a result, electronic health record use has now been adopted by 98.3% of hospitals. There are several advantages to using electronic health records. One is that it makes patient information highly accessible for providers. They can access it outside of the facility, and they can share it across care teams. It features hard stops, alerts, and reminders to help catch potential medication errors or safety errors before they happen. It helps with easier billing, coding, and reimbursement, and the documentation is more legible, so there's no more trying to decipher handwritten notes. There are also challenges to using the electronic health record. It can be time-consuming, and it takes away from direct patient care. User error and complex interfaces can lead to mistakes or frustration. There are significant security risks. If providers can access outside of the facility, then hackers may as well, and it puts it at risk for data breaches. Many providers experience user burnout due to the constant interaction and sometimes frustration it takes to chart everything or use it, and it comes with a high cost to both implement and maintain. There are several key factors that contribute to this burden. First, there's repetitive charting. Nurses and providers often have to enter the same information in multiple places throughout the patient's chart, which takes extra time and feels redundant. Documentation is also time sensitive, which can make staff feel rushed and increase the risk of errors. Staffing shortages add to the pressure. With fewer people to share the workload, the documentation demands can feel overwhelming. Many systems are not user-friendly. They have complex interfaces that slow providers down instead of helping them. And finally, there are strict compliance requirements, such as meeting legal and billing standards, which means more boxes to check and more forms to complete. Documentation is a critical part of nursing, but it can also be very time-consuming. Nurses report spending up to 40% of their shifts charting, which means there's less time at the bedside with patients. To keep up, many nurses end up staying late after their shift, which cuts into their personal and family time. This consistent and constant pressure contributes to burnout, as nurses struggle to balance patient care, documentation, and their own well-being. On top of that, frequent interruptions during charting can lead to errors and cause mental fatigue, making work even more stressful. When nurses are spending so much time on electronic health records, it often means less time for direct patient care. This can lead to delays in care, and patients may feel like their nurse is less engaged or distracted. In fact, studies show that 90% of nurses report EHR has negatively impacted their communication with patients. These challenges can also contribute to lower patient satisfaction, especially when nurse burnout becomes visible at the bedside. And with all the demands on nurses, there's a higher risk for errors and safety issues, particularly when cognitive overload sets in. Sometimes to keep up, nurses may resort to rushing through documentation or finding workarounds for system hard stops, which can further compromise patient safety. In a case study by Lindsay and Little, redesigning electronic health record documentation workflows reduced nursing reassessment time from 162 minutes to 132 minutes and significantly decreased cognitive burden for over 5,000 nurses in a large academic health system by identifying repetition and unnecessary steps, re-educating staff on the EHR system, and maximizing templates and macros. After a 3-phase documentation improvement project at academic health systems, the nursing documentation burden showed a significant reduction. The study included reducing non-meaningful documentation, redesigning flow sheets, and consolidating repetitive documentation. With the help of voice-to-text tools, over 2.6 minutes were saved per assessment compared to traditional typing. There are several solutions to help nurses and providers spend less time charting and more time with patients. AI documentation tools such as voice-to-text technology and AI scribes can help capture notes as providers talk, reducing the time needed for manual typing. Some organizations may use medical scribes or delegate certain tasks to other team members to take some of the load off nurses. The use of standardized templates and EHR macros help by reducing repetitive charting. Patient self-entry of information like their medical history, medications, or forms can help save valuable time for staff while keeping records accurate and up to date. Documentation burden impacts workflow efficiency, staff and patient satisfaction, and even patient outcomes. For nurses, there are several key implications. Use templates and macros to save time and minimize repetitive charting. Advocate for change by voicing the challenges that you meet with current systems and suggest improvements. Stay focused on patient care as it's the priority, even while meeting documentation requirements. Commit to continuous learning to stay up to date on new documentation tools and best practices. For healthcare institutions, invest in better technology and redesign tools like the flow sheets to make documentation easier. Provide training and support so nurses can use the systems effectively. Promote collaboration. Bring nurses, IT teams, and leadership together to find practical solutions. Listen to feedback from direct care nurses. They're the ones using the systems every day. In conclusion, documentation is a necessary part of nursing practice, but the burden it creates is very real. Good news is that data shows redesigning documentation systems and workflows can be effective in reducing that burden. Continued education for nurses and actively seeking nursing input will be key to making these solutions successful.